Hi guys, this is Shalini and I'm back to you with another video. Today the topic is respiratory alkalosis. We have already discussed about metabolic acidosis alkalosis and respiratory acidosis in our previous videos, the link of which I have left in the description box. So if you like the video and the content, kindly do like, share and subscribe. Also let me know your valuable comments in the comment box. Well, to begin with, respiratory alkalosis, in simple terms, it just means there is too much base inside the body or not enough acid. The reference value of pH is again given here. pH, the normal value is 7.35 to 45. The average what we take is 7.4. So if the pH is less than 7.4, we say blood is acidic in nature, and if it is more than 7.4, we say it is alkaline. The PCO2, the reference value is 35 to 45, which is again a kind of acid. So what happens in respiratory alkalosis is that the pH increases beyond 7.4 and this acid, that is carbon dioxide, decreases, making the blood more alkaline. Okay, so this is the acid-base mnemonic Rome, which we have already discussed in our previous sessions. I'd like to brief you again for the benefit of the ones hearing it for the first time. So respiratory opposite and metabolic equals. It just means that the direction of the defect is opposite in case of respiratory and it is the same direction in case of metabolic. So when we say respiratory alkalosis, the pH increases and the PCO2 has to go in the opposite direction, that is, it decreases. And in case of acidosis, the pH will decrease, then the PCO2 will increase. So these are few points that I want you to remember when we specially talk about respiratory alkalosis. So whenever we say respiratory alkalosis, the first word I want you to remember is the lungs, and more specifically hyperventilation. So what happens exactly? The lungs has got the major job of balancing the two gases, that is oxygen and carbon dioxide. But what happens in hyperventilation is the lungs starts to breathe too fast or too deep, and this causes a drop in the carbon dioxide level. As I've mentioned in the earlier slide, carbon dioxide is again a type of acid. When there is a drop in the acid, it lifts the blood to be alkaline in nature. The compensation is definitely by the kidneys. What does the kidneys do? It will try to excrete some amount of base, that is bicarbonate, and it will try to reabsorb back proton or hydrogen plus ions to make sure the balance between the acid and the base is maintained. So technically, if you look at the ABG, the interpretation of ABG as such, I've already told you that the respiratory, the direction of defect is opposite. So respiratory alkalosis, pH is between 7.35 to 45. So in alkalosis, we expect the pH to be increased. PCO2 would be decreased, that is in the opposite direction, and the bicarbonate levels would be normal in case of respiratory alkalosis. But when there is partial compensation, there is increase in pH, there is decrease in PCO2, and there is renal excretion of the base, that will leave the base to be decreasing, that is the bicarbonate levels to be decreasing. In case of full compensation, the bicarbonate level is decreasing, and because of the other supportive therapy that you're trying to give to the patient, the pH would come back to normal, that is between 7.35 to 45. But all that we have to understand is this kind of a full compensation or even a partial compensation by the kidneys would at least take 24 to 48 hours. What are the causes of respiratory alkalosis? The first thing I want you to remember is there is excess base, and the reason for the excess base is hyperventilation. So the happy reason here is hyperventilation is the only reason why a patient might present to you with respiratory alkalosis. But there can be many reasons why the patient presents to you with hyperventilation. For example, it can be pain, drug use, fever, infection, anxiety disorders, and too many more in the list. The clinical manifestations of respiratory alkalosis, so I have told you, the primary cause is always hyperventilation. There can be secondary causes also like anxiety, pulmonary embolism, fear, mechanical ventilation. So the clinical manifestations are hyperventilation, tachycardia, normal BP or drop in BP, hypokalemia, numbness and tingling of extremities, hyperreflexes, muscle cramping, seizures, anxiety and irritability. So the bottom line here is the pH is increasing and the carbon dioxide levels is decreasing. The treatment strategies for respiratory alkalosis is as follows. First thing is treating the underlying cause. Second is reassurance, especially in cases of drug abuse or anxiety disorders, this might do the job. Third is decreasing the ventilation, especially on patients. For patients on mechanical ventilation, you can think of reducing the tidal volume and also the respiratory rate. But for patients on room air, we can think of rebreathing into paper bag, where you ask the patient to rebreathe into a paper bag, that is exhale into a paper bag and then re-inhale back the same carbon dioxide, which might help you to balance the drop in CO2 levels. Pain management and sedation also can control hyperventilation in certain cases. Also remember that you have to avoid too rapid corrections. So a quick recap, I give you a scenario here. For example, a 33-year-old gentleman who is a known case of anxiety disorder and substance abuse presents in the casualty with a history of drug overdose. On clinical examination, the patient is hyperventilating, has got hypotension, has got tachycardia, and the ABG panel shows the following. That is, pH is 7.55, PaO2 is 60 mm of Hg, PaCO2 is 25 mm of Hg, and bicarbonate is 20 milliequivalents per liter. So as I have told you, respiratory, the defect is in the opposite direction. So this is 7.55, which says alkalosis, and it's in the opposite direction, so we say it is respiratory alkalosis. Now checking the compensation part. For compensation, there has to be renal excretion of the base. So the base is decreasing here. 22 to 26 is the normal reference value, but here it is 20 milliequivalents per liter. So this is partially compensated respiratory alkalosis because the pH is yet not normal. So thank you. I hope that today's video was useful for you. Please let me know your valuable comments and suggestions, doubts and clarifications in the comment box. Otherwise, thank you and have a nice day.